Thank you for that kind introduction. And just to clarify, I'm a PhD, not an MD. So thank you to the organizers for organizing this event. It is very important that we continue to have this conversation on the importance of cancer care equity, especially for marginalized groups. And thank you for this opportunity to share my story about my experience and journey with cancer and its treatment. I'd like to thank the organizers again for inviting me. And so I'll start with a little bit of what Dr. Khan mentioned earlier, which is about cancer statistics. And so cancer is actually the leading cause of death in Canada, according to the Canadian Cancer Society. 2 in 5 Canadians will be diagnosed with cancer, and the 5-year survival is 64%. So 1 in 4 Canadians will die from cancer. These are pretty bleak numbers. And when we look at the breakdown of the different types of cancers that are around, we can see that cancer affects all age groups. Depending on the age, you have different types of cancers that are more prevalent. So when you're young, before your teenage years, leukemia is the most common. And then as you get older, more different types of cancers become more prevalent. And it can also be segregated based on sex. So in women, breast cancer is most common, while in men, prostate cancer is more common. And in general, lung cancer is quite common in all groups. But we have these statistics and these numbers, and they tell us the importance of why we should care about cancer. It's important because so many of us are affected by cancer. With the statistics, these are just large numbers, but what do they mean? We are more than a statistic. We all have a story. The statistics do not tell the full story. I myself was diagnosed with breast cancer twice. My mother was diagnosed with breast cancer at the age of 36. I have friends who've been diagnosed with various cancers at various ages. I have colleagues and relatives who've also been diagnosed with cancer. Cancer touches all of our lives. Each of our stories, it's unique, but we all have similarities in how we deal with it. There are nuances in how we can respond to treatment, how we approach treatment, and there are also ways in which there are commonalities. And so when I'm sharing my story today, what I'm hoping that it will do, it will inspire us to look for the commonalities, look for the differences, and look for ways in which we ourselves can advance care for others as well as care for ourselves. So I mentioned that we are stories. And so I'll start with a little bit of my story. So I was 29 when I was first diagnosed with breast cancer. So actually stage 0 breast cancer, which is known as DCIS, or ductal carcinoma in situ. Some people debate whether or not it's real cancer or not, but it is treated as such. And so when I got this diagnosis, I was very shocked. I remember going into the hospital. I had symptoms, signs that something was wrong for months. I had prolonged discharge. And my primary care doctor at the time, she was actually a nurse practitioner. She was very hands-on, trying to get me some assistance, trying to figure out what was wrong. But several things were working against me. I was young, so they're like, why? This is unlikely. I tried, we did several things. We did ultrasounds, saw nothing. We did blood tests, nothing there. I wasn't allowed to get a mammogram because I was too young. This was actually in the US. And then, even though I had a family history, I was still not allowed to get a mammogram. Eventually, the symptoms continued, and we continued to push, until we finally got them to agree to give me an MRI, a biopsy MRI. And through this, they were able to discover that I had growth in my ducts. One of the interesting things I remember about this experience is when I actually went in for the MRI, and I remember meeting with the radiologist, and she said to me, "Why are you sending me here? You're just wasting your time." And I was just like, well, I've had symptoms for a while, and I also have a family history, so I'd just like to be sure. But she was still somewhat dismissive. Then, a week later, she called me and said, well, we have the results. Surprisingly, it turns out it is a cancer, it's PCIS. And I was like, oh, okay. My breast surgeon also called to share the results. And then it was a discussion on what to do. This was scary. I was, as I mentioned, 29. I was about to have my 30th birthday, and I was confused. I did not expect this to happen. I mentioned that I had a family history, but even still being aware of these things, even with your own personal screenings, there are some things that you can sort of ignore. There are some things that you can want to overlook. There are things that you will want to say to yourself, and making a big deal out of nothing. Thankfully, we have people in our lives who can help us to realize that no, we do need to advocate for ourselves, and we do need to keep striving. And one person for me was my then boyfriend, now husband, who said, no, something's weird, you need to get this checked out. And so he was one of those in my corner who was pushing for me to continue to go seek out what is wrong. And so I decided that I wanted to do an aggressive treatment strategy. It was DCIS, so they offered me, they could do a lumpectomy, but based on the size, it was rather large. Even though it was DCIS, it completely filled my ducts. It was about 3 centimeters in length. And we said, even if we did a lumpectomy, it wouldn't be aesthetically pleasing. So I also wasn't inclined to do a lumpectomy because I was just like, I just want it all gone. But I also said I wanted to prevent the likelihood of recurrence. So I decided to do a bilateral double mastectomy. And so the images shown here are of my surgery, my first surgery, where I was going in for the bilateral double mastectomy. And so shown here, it's before the surgery and after the surgery, and we don't have a laser pointer, but also after the surgery. I had immediate reconstruction at the same time. It was very painful. Thankfully, I had insurance in the US. It's one of the biggest things you have to be concerned about, whether or not you have insurance to be able to afford care. And we did have insurance, so I was able to afford care. It was good because it was quite expensive. So we have the story. We have a diagnosis, we have treatment. I chose an aggressive prospect. And one of the reasons why I chose this particular method, why I chose to do double mastectomy, is because of the impact of what I was coming from. And so going in, I mentioned I had family history. My mother was diagnosed at 36 with breast cancer, and she passed away at 48. I was 12 when she was first diagnosed, and I started undergrad when she had her recurrence. And I saw her treatment when I was 12, and that shaped a lot of how I thought about cancer and cancer treatment. It built in a lot of fear for me. When she got her recurrence, and I saw how aggressive it was, how the treatment was aggressive, how the treatment was aggressive on her body, I was fearful. I did not want to get to that stage. But I also was very afraid of what types of treatments there were. And so I said, the safest thing for me to do would be to do double mastectomy. My mother had a unilateral mastectomy, chemo and radiation, and when it recurred later, she also went through chemo again. But it was pretty aggressive and she passed away. One of the things that's important here in this conversation is also conversation. It's also talking about it. My mom was a public health nurse, and so she lives in an environment where we're always talking about health. she encouraged us to have our breastfeeding. She encouraged us to make sure that we're aware of our bodies. But there's still things that we can have that make us reluctant to actually engage with these things, to engage with our health, to engage with our bodies, to think about the fact that we can be fallible. But the fact that we can also talk about these things will help us raise awareness. I knew I had a history, so I knew it was something that I should be aware of. But one of the things that we didn't talk about, because I was so young, and later, because of the stigma associated with talking about health, particularly my father doesn't like to deal with anything with sickness. He's a pastor, but he doesn't like the fact that sickness touches our lives. I know my mother had breast cancer, but I don't know what type of breast cancer she had. I don't know what stage she was diagnosed at. I don't know what subtype, whether it was triple negative, whether it was hormonal. I know it was very aggressive. And I know she went through really aggressive treatments. And we did this when we were in Jamaica, so I know that at the time, not a lot of the available treatments were readily accessible. One of the things was that for some of her medication, you actually had to import it into the island because it wasn't available locally. And so that was one of the things that we struggled with because of the fact that we lacked accessible care. But she still got the care that she needed. It was just that it was a different time. So again, my response is how I decided to tackle my first diagnosis was shaped by my history, the fact that I had thought about the fact that my mom had breast cancer, the fact that she had a recurrence, and the fact that I was scared of the different treatments that were there. And also the fact that once I had the bilateral mastectomy, that was it. I didn't have to think about anything else. At least that's what I thought. I eventually moved to Canada with my husband 3 years ago now. It's actually 3 years this week that we've been in Canada. And we've been having a very good time. We love Canada. And this is just a view outside of our window. It was after rain. I thought it was a beautiful rainbow, sort of like hopeful. And that's what I'm hoping that we leave with at the end of this. That in spite of the clouds, there's always a rainbow. There's always hope. So I say, write your plans in pencil and give God the eraser. So I mentioned that I did a bilateral mastectomy because I was just like, I don't want to have to think about this anymore. I want to be safe. But it can still come back. And this is not to put anyone in the doldrums to say that, oh, you did all this, but it still came back. No, we still have to be aware. We're not 100% foolproof. We still have to take care of our health. We still have to access resources to get our health, and things can recur. And so when I was here in Canada, my husband and I were at the point where we were thinking about starting a family. But then I had a reconstruction, and at that point I noticed that I started to, well actually my husband really noticed that I started to get some additional growths on my breast again, or the skin above where my breast would have been since I had a mastectomy. And we went in. We didn't have a primary care physician at that time because of that we just moved to Canada. So I went to a walk-in clinic, told them my history. I also talked to my previous oncologist back in the States, and they were like, it's unlikely to be anything. It could be fat necrosis, which is basically fatty cells just breaking down in the tissue. Or it could just be a fibroadenoma, which is sort of like a growth that responds to your hormonal cycles, but it's not cancerous. We did ultrasounds, it looks normal again, and then we did another growth happened. We did more ultrasounds, and then another growth happened. And so we said, let's do a biopsy this time. And I remember going in to the breast surgeon to get follow-up on the results. I just come back from a conference in the States, and we were saying, okay, I'm coming in and going to go to this one. She called while I was away and said, oh, you have to come in for a meeting with me. So my husband and I were going in. I remember there was a dead bird outside the office, which was ominous. And it was rightly so. She went and said, we were surprised to find that it's again a cancer. It was a mucinous variant of a hormone-positive breast cancer. And so that means it's a slow-growing variant, but it is still hormone responsive. So this was another surprise. One of the things that happens when you have a cancer diagnosis is that you are shocked. Regardless of whether you have family history, it is not something anyone goes about looking for. We're just not going out and saying, oh, I'm going to get cancer. Even with the statistics telling us that 1 in 2 Canadians will get it, or, 1 in 2 Ontarians, or 2 in 5 Canadians. This is not something we're going looking for. And so regardless of whether or not you're mentally prepared, or you think you're mentally prepared, it can come as a shock. And especially going in thinking that I've taken care of everything, this was definitely a shock. I remember when I shared it with my extended family, my parents, they were like, but how? They were very confused. My sister thought I was joking. Bad joke, but she thought I was joking. She was very confused as well. And so we decided to move the implant, and this time, because it's a recurrence, and this time because there was also some involvement with the skin, we went for radiation. There's also one of the things, again, that brought back my fear. My mom had a recurrence, and having a recurrence. I saw what chemo did. One of the things that has scared me most about cancer treatment, and it's perhaps again based on my own experience with my mom's care, but not about the current standard of care, is chemo. So this scared me. And so the debate was whether or not I needed chemo. And when my oncologist decided, we met with the panel and they decided that based on the results, chemo would not necessarily be beneficial, I was very happy. I didn't mind radiation, but chemo scared me. Even though I didn't have to go through chemo, just through radiation and through surgery, it is a lot of struggle. You require a lot of support. You're going to require support financially, emotionally, and spiritually. And where do you get the support? How can you continue to survive and thrive even while dealing with a cancer diagnosis, going through treatment? For myself, it was through my community. My family rallied around me. And even after diagnosis and further into treatment, I could still make new friends and new community, new people that I could meet with, get along with, and associate with. That picture, where they turned on its side. Interesting. And these are the people who will help you through. They're the ones who will be your champions. They will be your cheerleaders. They'll be the ones who will help to pick you up when you are in your doldrums. But they're not the only ones who can do that. Sometimes you have to go to professional help. Dealing with recurrence, one of the things I had to deal with was the fact that I felt like a burden at times. And so I had to go to professional help, someone who I could talk to. And that is one of the things we need to be able to be comfortable accessing. Because we have our friends, we have our family, and we may feel like we're burdensome to them, even though they tell us we're not. But we feel that. And so we have to be able to find someone else. And that's the importance of basically having equitable access to resources that will allow us to be able to not only rely on our family and friends, but also others. So, again, back to the statistics. Cancer can affect any of us, any age, and 2 in 5 Canadians will be diagnosed with cancer. So what affects the likelihood of diagnosis? Well, lots of things. Also, some things are just random. It is not your fault, but there are things that we can do to help improve our health so that even if we do face a diagnosis of cancer, we stand a better fighting chance. Eating healthy, exercise. That's always easy and good to say, and it's actually a pretty simple answer. And that's because whenever we're faced with a cancer diagnosis, we're not the only ones who are suffering. The person who is dealing with cancer is dealing with emotional and psychological impact. They can suffer from PTSD in terms of the trauma associated with treatment, including surgery, as well as radiation. They might suffer from somatic symptom disorders, which is they feel like they're experiencing things within their bodies that are not necessarily related to actual physiology. So there's no actual symptoms or physiological symptoms of what's going on, but you feel that something is wrong. This can be before or this can be after. And not only does it affect the individual who has cancer, but it also affects the family members. They themselves may have anxiety, they themselves may have trauma that's associated with treatments. That's why it's important that we continue to have the conversation. So apart from the psychological and emotional challenges, we also face social and economic challenges. Cancer care is expensive. In Ontario, we have the Ontario Health Plan, so we do have a universal health plan, if you will, that will take care of a lot of the costs associated with surgery, radiation, and chemo. But then there are other aspects, such as once you are out of the hospital, how to maintain and how to afford the drugs that are necessary to sustain your life or to sustain your health. Those can be very expensive. Also, there are lots of side effects associated with some of these drugs that can affect your daily life. How fit you feel, whether this is sexually or otherwise. How emotionally durable do you feel? Do you feel strong enough? And so you might need additional social or medical support to be able to handle these stresses. And so, what are the resources that are available for us? So, in terms of understanding what your risk factors are, in terms of understanding what's your likelihood, or learning more about different cancers, we have the CancerCare Ontario, which has My Cancer IQ, which you can go in and you can enter information. And it's not supposed to replace your doctor, it's not supposed to replace medical care, but it's supposed to give you advice on different things that to help you be aware of, okay, these behaviors can increase my likelihood, or this particular history should make me concerned about the likelihood of being at risk for one of these cancers. While we're here in Waterloo region, our care is coordinated by the Waterloo Wellington Regional Cancer Care Program, and especially here in Waterloo Kitchener by RAN Cancer Center. And because myself, I'm a person who has had breast cancer, I'm going to speak particularly about the breast cancer screening program, especially for people of high risk. But there are other screening programs available within Ontario that I would encourage you to speak with your primary care provider about for screening for breast, cervical, colon, and lung cancer. I mentioned that cancer care is expensive. It's not only impacting the fact that you're going to have to be paying funds into your cancer care, but you're also going to be affected by whether or not you want to start your family. Chemos can affect when you start your family, especially if you're of childbearing age. And so Ontario does have plans in place to allow for, if you're undergoing certain types of cancer treatments, to allow for fertility preservation that is covered. So again, speak with your oncologist about this. And then we have organizations like Alliance for CancerCare Equity that are important in helping everyday Ontarians who are underserved, especially in the Kitchener-Waterloo area, as well as individuals overseas, international in Ghana, to help afford cancer care and be able to fight cancer. The other thing that we need to think about is not just actual care for cancer, but also the survivorship. What happens after, and how do we continue to progress? And so, one of the things I would like to leave with you as I close is that while you're going through cancer, whether you yourself have been diagnosed, or if you have a family member who has been diagnosed, or you're part of the care team that is treating someone who has been diagnosed, two important things that are going to be quite critical to learning to lean and relearning ways to lend a hand. A lot of us are naturally caring. We want to help others, but the ways in which we care, the ways in which we help, the ways in which we lend a hand must be accessible and must also be appropriate. We can't enforce our will on others, but we also ourselves have to learn to accept a helping hand. A lot of us like to think we're independent and can do it all on our own, but that's not how we build community. We build community by lending support. And so, one final quote is that cancer is not the entire story. It is only a chapter in our lives. And that chapter is just part of the beautiful story that is our lives. Thank you.